Okay, what do we really mean when we say something is infectious? What is an infectious disease? Does it mean we have infections which are not infectious? So let's dive into prevention and control of infectious diseases. So we are going to be looking at what are infectious diseases and what do we mean by when we say infectious and what can we do to prevent and control infectious diseases. And with this, I want to say thank you for your support and kindly share and subscribe to my YouTube channel. So infectious diseases are illnesses mostly caused by harmful germs, that is pathogens, that get into your body. So most common causes are viruses, bacteria, fungi, and parasites. So we are going to have, as a result, different types of infectious diseases categorized based on what causes the group of that infections. So the first group is viral infections, and these are infections which are usually normally caused by viruses. The second one is the bacterial infections, which is usually caused by bacteria. The third one is fungal infections, and these are infections caused by fungus. Then parasitic infections. Parasitic infections are infections which are caused by parasites. And then we have the prion diseases. So prion diseases are, like, for example, the transmissible spongiform encephalopathies and are caused by faulty proteins that make other proteins become faulty too, as also as a result. Common infectious diseases. So common infectious diseases, we have diseases like the common cold, COVID-19, flu, hookworm, HPV, and tuberculosis. So what are the most common symptoms of infectious diseases? So most infectious diseases will show symptoms which are not limited to chills, cough, fatigue, headache, fever, and muscle aches. So how do infectious diseases spread? So infectious diseases are going to spread from person to person when you cough, through close contact, like for example when you are doing, for example, the sexual intercourse, or sometimes you can have the infectious diseases from surfaces by touching infected surfaces. You can also get them through bugs and animal bites. Well, we also have cases of contaminated water or food, blood during blood transfusion, and lastly, or not the least, from pregnant women to fetus or newborn. So, how do we test or diagnose infectious diseases? So, we can test through different tests, and these are not like swabbing nose or throat. You can also get your blood tested, your pee tested, or your poop. Sometimes, for the case of tuberculosis, you're going to have the spit samples being taken to test for the sputum being tested for tuberculosis. And then we have the taking of a biopsy, and you can also get imaging. Okay, so now we move on to management and treatment. So treatment and management of most infectious diseases is usually they're usually treated or managed based on the, like we said, the categories, based on what causes the infection. So if an infection is caused by bacteria, we are going to have antibiotics being administered. We have antiviral medications for the viral infections, antifungal medications for the fungal infections, antiparasitic drugs for the parasitic infections, and in some cases where the infections have spread to organs, we may have surgery being a treatment as a result of maybe the spread, depending on the seriousness of the infection. Then we move on to the next, which is prevention. So how do we prevent infectious diseases? So there is no like a single way that we can say it's 100% effective in preventing infectious diseases. However, we can come up, we have guidelines and some of ways we can use, a combination of ways to prevent ourselves from getting infected by these diseases. So the first one is, if there are vaccinations, for example, for a certain infectious disease, like for the way we had the one for COVID-19, you get recommended vaccinations, practicing safe handling of food, washing your hands with soap and water to get rid of any bacteria or viruses which may remain in your hands as a result of maybe you have touched a surface. Then being courteous to others. When we say you are being courteous to others, this means if you have a cough or you have a running nose, you should cover your mouth and nose when you are coughing or sneezing. Then you practice safe sexual practices and avoid bug bites or the insect bite. Okay, and with this, I would like to say thank you for watching my channel. And in case you have any recommendation, or there is something you have not understood, or there is something you want me to clarify or do a video on, kindly comment on the below the video and let me know your suggestion and what you would like us to improve going forward.